Hi, my name is Lainey Pugmire, and I will be talking about home births for my controversial topics presentation. An introduction. I don't know if it's my Instagram feed or just what I am seeing, or if it's really that common, but I feel like I honestly have been seeing a huge conversation about more women leaning towards more unmedicated, holistic, natural births. And this is why I chose this topic because I think that it's something that is still being contested today between women. Are hospitals safer? Is it better to have an unmedicated, more holistic birth? And so, to introduce this topic, I just wanted to point out this wonderful graph that was made by the CDC, basically showing that many women each year opt to have a at-home birth for convenience, comfort, and a more natural approach to birth. Right. So, if we see this chart, the darker teal is 2019, then the light colored teal is 2020, and then the cyan or dark blue is 2021. And that shows that each year consistently, if we look at the total, the number of at home births has increased. What I also find shocking is that it hasn't just increased within the white population, although they do have the highest numbers, but there has been a steady increase among Black and Hispanic populations in the United States as well, which is fascinating because usually we see a demographic shift in one area, but this is almost a cultural shift in the United States, regardless of ethnicity or race demographic. I also loved this graph by the CDC, and it shows mapping the United States. The darker cyan or teal shows a significant increase in the changes of and the percentage of home births by state residents. The light teal is significant decrease, and then the gray is no decrease. There were only two states that I saw on this chart, maybe three: Rhode Island, Connecticut, and New York, that have had a significant decrease in home births. Whereas we see a lot of states either have no change or a significant increase. And honestly, more states have had a significant increase. Utah being the top six, so the sixth highest rate at 3% of all births. And that totals to about 1,300 births every year are birthed at home in the state of Utah. I think this is interesting. I'm from Idaho, and now that I live in Utah, I mean Idaho is even higher than Utah is on on the rate of which births are at home. But I live in an area where this is the cultural change that's happening. We're seeing a higher amount of women opting for home births. I got this source from Statistica, and then the MB, and that was the percentage of births of Utah. So some terms to know as we move forward. Midwife, they deal with pregnancy, childbirth, as well as pre and postnatal care. They tend to be more holistic. When we think of a birthing center, the midwife is going to be in charge of most of the medical needs of the expectant mother. They are going to be taking vitals, doing all the things that a traditional doctor at a hospital would do, but with less intervention, meaning they're not going to do a cesarean section. They are not going to have a epidural. They're more holistic, but still the doctor of the home birth and birthing center route. A doula, although they can get confused with the midwife, is the non-medical care or the lead of the non-medical care of the birth, right? So their main goal is aiding for the birth for as much comfort and calmness as possible. They help the expectant mother through breathing techniques and birthing positions and making sure that she feels confident and secure in her ability to birth her child. Now, birthing centers are another term that are synonymous with home births. Typically, when we see home births, it usually means either at home or at a birthing center. They're not part of the hospital system. They are lower treatment, usually unmedicated, and they are more holistic. And I got that information from the Mayo Clinic, Harvard Health, and the Cleveland Clinic. So the conflict arises is, are they safe and or medically responsible? So the pro home birth says that it's low risk. Similar successful birth rates are compared at birth at home, like at birthing centers, when compared to hospitals, when for low risk women, meaning that if you opt to not have a birth in the hospital, it isn't more dangerous for you if you're a low risk patient. 87% of women who opted for home births did not need to be transferred to the hospital, meaning their birthing experience went smoothly and they didn't need more medical intervention than the birthing center or the home was able to provide. It's a more individualized plan. It can be more personalized and intimate, right? The birthing mother has more say in exactly what she wants within her birth. It's safer with you and it has fewer interventions, are some of the arguments for this side. You don't have to have a cesarean section because you don't have an epidural. You're able to communicate what part of your body is in pain and they can figure out a natural way to alleviate it. With that being said, it's more natural and holistic. The belief that the woman has the abilities to succeed in birth is a large part of the pro birth movement, meaning women don't need all these medications to do a hard thing, and women feel more confident after their birth because they were able to do it unmedicated. Anti-home birth side talks about the risks. It says, yes, while women with low risks, there isn't much of a statistical change. High risk pregnancies are more likely to have problems, right? If women might need a cesarean section or they have multiple babies like twins, triplets, or quadruplets, then they home birth could be detrimental to the health of the mother and the baby. Increased risk for healthcare providers against litigation. If something goes wrong in a birthing center, they don't have the traditional ways to protect themselves as a large hospital would. 1 in 1,000 births have neonatal death at the birthing center. And births in a birthing center are 3 times more likely to have neonatal seizures or psychological problems. Those are scary numbers. The pro hospital side says that in a hospital, there's an increased comfort that everything will be okay and you're better equipped for emergencies. So if something goes wrong, the health of the baby and the health of the mother are in jeopardy because the hospital has all the necessary tools to help the mother in need. And then we have questions, right? The anti births argument has questions about the lack of data surrounding safety. There hasn't been much data done in home births, and there's a lot of talk within all the research articles that I've read that there's not enough evidence to ensure safety at a birthing center. And then also the fact that it's not well implemented in the US healthcare system. Most families don't have insurance and it's not supported by hospitals nearby. So women are left ultimately on their own in the birthing center. My opinion, I have a few opinions and I'll talk about my overall in the next slide, but these are some of the things that really came to my mind as reading. High risk mothers should give birth in the hospital because they will need and will more likely to need interventions. A well thought of birth plan, if decided to go to the at home route, is needed with emergency plans, and you need to be close to a hospital in case the emergency does happen. I think there's a lack of overall knowledge about the dangers or the benefits of home births, and that needs to be studied. Infant mortality rate may also have to do more with a national development status than place of birth. Meaning, if you are a lower developed country, you're probably going to have higher infant mortality rate. If you're a higher developed country, you're going to have lower infant mortality rate, regardless if it's at a hospital or birthing center. I love this quote that said, thus, it cannot be claimed that a hospital birth is safe for all babies, nor can it be claimed that a planned home birth is safe for all babies. And this really shows that the duality of yes and no and individualized care and treatment. My overall opinion has to do with my niece and my nephew. My sister gave birth back in November of last year, and my sister in law gave birth in May. Both of them wanted to go to the at home or birthing center route, but because of insurance, they weren't able to do so. Luckily, they were at the hospital because both of them had severe complications in their birth. My sister, the umbilical cord was wrapped around my nephew Flynn, and every single time she had a contraction, his heart rate dropped. My niece Leah, when my sister in law was in labor, was stuck in the birthing canal and couldn't get oxygen. And I'm very grateful that they were at the hospital because they were able to intervene and deliver these babies safely, and now they're healthy as possible. So, my argument, and that could possibly be my bias, is that because of the lack of predictability in birth, that hospital births are the better option. And that is my presentation.